So the first most important distinction that I want to say is those of you who are using electronic charting but are not authenticating each entry, you are shooting yourself in the foot because it's just basically like writing your chart in pencil. You could erase anything and put in whatever you wanted. So unless it's date and time stamped, when you finished entering it, it is not legally binding. At the end of every single section of each chart, so you have a demographics, you have a billing page, you have all the prenatals, you have their history taking page, you have the labor and birth, postpartum, newborn, all of that. At the bottom of every one of those entries, and then the whole page in general, is a place to authenticate. And so every charting system will ask you twice, do you really want to do this? So you click on the button and a little pop-up happens and it says, do you sure you want to close this chart? And you could exit out if you weren't done. But then once you choose yes, the whole chart gets closed and it gets date and time stamped with your name. And then if you tried to click on it, you couldn't do anything. So going back to those time frames, we ideally want to complete charts within the 24 hours of the visit, but we have up to 5 days, knowing that the expectation is that according to your schedule, you would finish any charts before you went to the next venue of care, right? So if you're doing prenatals in the office, you'd finish your charts for those 1 or 2 days of prenatal before you got called to a birth. And the thing about midwifery is we never really know we're going to get called to a birth, which is why you really have to get very, very, very diligent about finishing each day's work.